Hello, my name is Becky. I'll be your nurse practitioner today. We're going to do a full head to toe assessment.
Okay.
So we'll get started with your head. We're going to start with scalp, hair, and cranium. So I'm just palpating here, looking at hair distribution, looking at the scalp for any lesions, and palpating the cranium for any abnormalities, tenderness, lesions. And then we'll look at the face, looking at the distribution of the features on the face, the symmetry of the eyes, nose, mouth, and ears, and their position on the face. And then we will proceed with our eye exam. So we'll start with visual acuity. In a normal clinic, we would just use a Snellen chart, but I'm gonna hold this chart for you, starting with, let's do left eye first, so cover your right eye, and read me, starting from the top as far down as you can, the letters.
E-L-T F-P-H O-L-C-F D-H-J-B-S E-P-T-Z-O C-F-D-H-J L-T-F-P-H.
All right, good job. And now you can switch to the other eye and do the same process.
E-L-T F-P-H O-L-C-F D-H-J-B-S E-P-T-Z-O C-F-D-H-J L-T-F-P-H.
All right, and then both eyes together.
Okay. E-L-T F-P-H O-L-C-F D-H-J-B-S E-P-T-Z-O Z-O C-F-D-H-J L-T-F-P-H.
All right, nicely done. All right, we'll look at your corneal reflex next. So you can just kind of look straight ahead at me, okay? So looking straight ahead here. Just making sure your pupils are responding to light. Looks good. And I'm just gonna look at your external eye structures, the lids, the lashes, looking for any edema, distribution of the lashes. I'm looking at the conjunctiva as well, so I'm just going to highlight them here. I'm looking for the color of that membrane, looking at the sclera and the iris, and then I'm going to take a look at the lenses with my scope here. All right, we will move on to ears. So we'll just start with an external ear exam. I'm just looking at the structure of the ear, looking for any obvious drainage, redness, making sure my patient doesn't appear uncomfortable. So we'll do that bilaterally, and then we'll proceed with our ear exam using my otoscope here. So in each ear, I'm looking at the ear canal itself for any redness, and I'm looking at the eardrum for the cone of light and the color and shape of the drum as well. Looks good. And then we'll just do a basic hearing exam. So standing behind my patient, I'm going to have you repeat the words that I whisper to you.
Okay. 1, 2, 3. 4, 5, 6.
All right, nicely done. We will also look at the temporal arteries. So I'm just going to palpate both of those on both sides. There's 1, and there's 2, making sure my patient is not tender there. And then I'll assess the temporomandibular joint. So I'll have you open your jaw and close, move your jaw side to side, perfect, and then back and forth. Nice, okay. And then move your jaw back and forth one more time, and side to side. So I'm looking for tenderness when they're moving and feeling for any popping. I'm going to feel the maxillary sinuses, assessing for tenderness, and the frontal sinuses for tenderness. Good. We will now look at the nose. So I'm just looking at the external nose. Once again, looking at the structure, looking for redness, obvious drainage, any crusting. I would usually use a speculum. If I had that attachment, we'll just kind of glance inside the nose here, looking at the septum, looking at drainage, hair distribution. and we'll move on to our mouth exam, mouth and throat. So we'll just start looking at the lips here, looking at color of the lips, looking at moisture, shape of the mouth, and then I'll have you open your mouth. I'm looking at teeth and gums here, looking for swelling of the gums, irritation, poor dental hygiene. I'll look at the tongue. You can stick out your tongue, perfect. Looking at color, moisture, and then I'll have you just open your mouth and lift up your tongue. So I'm looking at the soft palate, and then I'll look at the hard palate, and again looking at color, looking at different lesions, and then I'll look at the buccal mucosa, looking at color, moisture, skin condition, and then stick out your tongue and say ah. Looking at the pharynx, the tonsils, and the uvula. Looking for swelling, any abnormal color, and making sure the uvula looks midline. So that concludes head and face, and we will move on with our neck assessment. So we're just going to begin assessing for lymphadenopathy here. So in all of the locations of lymph nodes, I'll feel down the neck, posteriorly as well. So I'm feeling for any presence of lymph nodes as well as tenderness in my patient. I'm going to identify the carotid pulses next. There's one. Do this one at a time. There's two. Feeling for regularity there, and we'll listen over those as well. I'm listening for bruise. All right, sounds great. I'll assess the range of motion of the neck as well. So if you could bring your chin to your chest and then head all the way back and turn your head from left, perfect, to right. And then kind of touch ear to shoulder on one side and ear to shoulder on the other side. Awesome, looks good. And then just shrug your shoulders here. Perfect, and shrug them all the way up. Great, looks good. We will move on to thorax and lungs next. So we'll start with thorax. I'm gonna assess for CVA tenderness. So just tell me if what I'm doing is uncomfortable. Does that hurt?
No.
Okay. All right. We'll do a brief just inspection while we're examining, but making sure work of breathing isn't increased, no retractions, and then we'll listen to breath sounds. Starting anteriorly, you can just breathe like normal. We'll do laterally. And we'll do posteriorly as well. Okay, so we will move on to precordium, chest, and jugular vein. So I'm going to have you lay on the couch here.
Sure.
Perfect. Okay, so starting with inspection, I'm just going to look at the chest here, looking for any heaves or obvious pulsations that I can see with the naked eye. While I'm doing that, I'm going to look at the jugular veins for any distension here. It would be normal supine like this to see just a little bit. And then I'm going to listen to heart sounds, starting in the aortic area here. And then pulmonic, it's 2 points. Erb's point. the tricuspid area and the mitral area. Awesome, sounds great. Now we will do the abdominal exam. So just starting with inspection, I'm looking at the contour of the abdomen, looking for any obvious distension, lesions, masses that I can see. I will look for any pulsations of the abdomen as well. And we'll move on to auscultating the abdomen. So we'll listen in all 4 quadrants, listening for hypo or hyperactive bowel sounds. Right, and then we'll do some light palpation first. I'm assessing for any tenderness in my patient. I'll watch him while I do this, and I'll have you tell me if anything hurts. And I'm feeling for any masses, any areas that are hard. Again, watching for any tenderness in my patient. And then we'll move on to deep palpation. The same situation. If it hurts, just let me know.
Okay.
And just relax. Okay. So we'll move on to upper body now. So I'm going to start with inspection, looking at the arms, the contour of the arms, muscle distribution, looking at hair distribution as well. We'll move on to the hands, looking at fingers and nails. Again, hair distribution, I'll check capillary refill of the fingers, the warmth of my hands, both are nice and warm. Looking at the nails for any clubbing, any cyanosis. Looks good. And we'll go to do some range of motion of the arms. So you just relax and let your weight kind of fall in my arm here. Do range of motion of the shoulder, of the elbow, of the wrist, and same thing over here, shoulder, the elbow, and the wrist. And then we'll do strength of those. You can relax it. Now, ideally he would not have this barrier here, but I'm gonna have you push against my hands, push your arms out. Perfect. And then kind of bend your elbow here. Push against my hand this way. Good, and push down. Awesome, and the same thing over here. Bending your elbow, push against my hand. Great, and push down. Awesome. Squeeze my hands. Awesome. Okay, and then we'll feel brachial pulses on both sides. And radial pulses on both sides. We'll do lower extremities now. All right, so starting with inspection once again, I'm going to be looking at hair distribution, looking for any edema, looking for cyanosis, particularly in the feet. I'm going to feel the temperature of the lower extremities, making sure the feet don't feel significantly colder. Looking at hair distribution on the toes as well, and looking at the toenails and capillary refill of the toes. Looking at muscle distribution of the legs as well. And then we will move on to pulses, starting with popliteal pulses bilaterally. And And then posterior tibial pulses bilaterally. Excellent. There's one. And two. And then dorsalis pedal pulses bilaterally. There's one. Perfect, and two. I'll assess range of motion one more time, so just stay relaxed here. I'm gonna kind of move you at the hip. Awesome. Hip out and in. And then at the knee, extending and flexing that knee. We'll do that on both sides in a clinic setting. And then I will assess range of motion of the ankles. Awesome. And then we'll do strength of the lower extremities. I'll have you push against my hand. Push up, great. Up, and then I'm gonna bend your knee here and push down against my hand. Great. We'll bend and push down. Awesome. All right, I'm gonna bend your knee slightly again here. So just relax the knee and push up your ankle, right by your ankle. Great, and pull down. Same thing here. Push up and then pull down. Great. All right, and then we'll do strength of the feet. Push up against my hands and then push like you're pushing a gas pedal. Awesome. Okay. We will proceed with the neuro exam next. So I'll have you hop back in the chair here. We'll start with deep tendon reflexes. We'll do biceps first. So just kind of relax your arm. Okay, one more side. And triceps next. Keep your arm relaxed. And relax this arm on this side. And do patellar. Ideally, his feet would not be touching the floor, but this will do. So I'm gonna just relax your leg outward like that and just kind of let it dangle. Okay, and next leg. All right. Great, and then we'll do Achilles. So just kind of extend your leg, perfect. All right, one more side. Great. We will do the Babinski reflex next. So looking at the bottom of my patient's foot, I'm gonna trace the outside of the foot. Both sides. Awesome. All right, and then I'm gonna assess my patient's gait here. So I'm just gonna have you get up and just walk back and forth like you normally would. And then back toward me. Perfect, and you can stop there and we'll do a Romberg test next. So I'm gonna have my patient just stand straight and close your eyes. And just stand still here for about 30 seconds or so. So I am assessing my patient, making sure that he is not falling during this exam. A little bit of swaying is totally normal. All right, we're about halfway done. Excellent. All right, 5 more seconds. Okay, and then we're gonna do a back exam. So I'm gonna just look at this shape of my patient's spine, looking for contour here for kyphosis and lordosis. I'm going to do a brief scoliosis exam by having my patient lean over as if you're touching your toes. Great. So I'm looking at the contour of the back here, making sure that the spine looks straight. All right, and you can stand up. We'll do range of motion of the spine next. So I had my patient lean over already. I'll have you kind of arch your back with your head looking toward the ceiling. So kind of arch backwards, if that makes sense. There we go, perfect. And then lean from one side to the other with your spine bending. So like this, from left to right, perfect. Okay, great. And that concludes our exam.